This is CNN Money Switzerland with your latest in coronavirus news updates. I'm Ana Maria Montero. Tonight on the program, Switzerland takes steps to avoid recession, but is it enough? And the U.S. sees whopping, record-breaking unemployment figures. We dig deeper tonight. Plus, an update from Ticino, one of the hardest hit regions here in Switzerland, with Dr. Paolo Ferrari, head of the Cantonal hospitals. And a new treatment that can actually make face masks more resistant to coronavirus. Tonight, we talk to the Swiss chemicals company behind this potential solution in the fight against this disease. But first, here are some news headlines in Switzerland this Thursday. After much discussion, Isabelle Moret, president of the National Council, announced today that Swiss Parliament will hold an extraordinary session of both chambers in Bern during the week of May the 4th. Novartis will join forces with other pharmaceutical life science companies to accelerate the development, manufacture, and delivery of vaccines, diagnostics, and treatments for COVID-19. Art Basel will delay its signature Swiss Art Fair, originally slated for June, until September. Fair officials announced today. Public show dates are now slated for September the 17th to the 20th. It will be the fair's 50th edition. And the number of Americans filing for unemployment surged to 3.28 million last week, shattering a decades-old record, and is well above the level seen in the midst of the 2008 financial crisis. Joining me now to discuss that and more is Chief Investment Officer Norman Villeman of UBP Bank. There you are, Norman. Always a pleasure to see you.
Hello, Ana Maria.
All right, so these jobless claims figures are basically the quickest window into the health of an economy, right? And at 3.28 million, I mean, what is this telling us? Is this just the tip of the iceberg?
Look, it is the tip of the iceberg. What it's telling us is the economy came to an abrupt stop just in the past couple of weeks. But really what I think investors and people should be focusing on is not necessarily these numbers. We know these numbers are coming. We know these numbers are going to be bad. But instead focusing on how quickly policymakers are coming to try and offset these numbers with fiscal stimulus and support for the unemployed. And we just saw that out of the U.S. with about $2 trillion in spending passed out of the Congress.
Now, are these numbers you just mentioned, they're going to be worse? How much worse? What are we looking at? I mean, I assume that recession is definitely still on the table.
Recession is definitely still on the table. And if you look at the shutdowns across the United States, they've really begun on the coast and are starting to move inland. And so this is a process that will take place over the next couple of weeks. And so we should expect these kind of elevated numbers for at least the next few weeks.
And how will this impact Europe?
Well, obviously, Europe, the United States is a very big trading partner for Europe. And so that demand shock that Europe was already experiencing in terms of its own domestic shutdown is now going to be amplified from the trade angle as well.
And if we look at a recovery, let's be positive here. If we look at the recovery now, what are you thinking? V-shape? How quick will this be?
Yeah, I think from a recovery perspective, we're lucky. We can look at what's happening in China, which is a couple months ahead of everybody. And what's happening there is a slow and steady recovery rather than a V-shape. So we want to be fairly cautious about the prospects for a very sharp recovery as we look forward.
Now, if we look at measures to contain financial hardships, for example, the SNB announced more funding for companies here in Switzerland. Question to you is, how much of this is really to help banks? And how much of it is really for the companies they say that it's for?
Well, I think what you're seeing is really a holistic effort on the part of not only the SNB, but of governments to try and address the issue. So yes, they are providing help to banks because companies have already drawn down their lines of credit. And so they want to make sure banks have enough liquidity to continue supporting companies, because by doing that, companies can keep people employed, keep paying them, and keep the economy at least stable looking ahead.
Yeah, there's no doubt, as you said, the banks are in need of help now, when it comes to liquidity. And you've got UBS and Credit Suisse asking their wealthy clientele to stump up additional backing against loans and also cutting credit to rich clients. I mean, when you hear these things, how bad is it? How big are these liquidity crises?
Well, if you think about it, again, if you're a company today that was operating normally and then all of a sudden you have no customers in your store, your option really is to call the bank and say, okay, I'm going to draw down a loan that we've agreed on. And so that draws liquidity from the bank. And that's what companies around Switzerland have been doing. And so the S&B rightly has opened up liquidity to them to allow them to continue doing that. So they can continue to stay in business. And I think that is, again, the right response in this current environment.
And if we look then, Norman, at the broader economy, how much of this money will be used in that context, and as opposed to just filling the liquidity needs of the banks?
Well, I think the money will be used because, again, companies are drawing this down. They continue to pay people. I think what the challenge will be is, again, the stores in Switzerland, you can go to the grocery store, you can go to the pharmacy, and that's about it. So that multiplier effect of consumption is much lower than it would otherwise be.
All right. Well, thank you so much for joining us tonight, Norman, and thank you so much for your insights. Always a pleasure.
Thank you.
When Dr. Paolo Ferrari, head of the Cantonal hospitals in Ticino, spoke to us a week ago, he said the situation there was similar to the one in Italy just 2 weeks ago. Tanya Koenig caught up with Ferrari again earlier today.
So we received 30 ventilators of the latest model, high-quality ones, and they're all already in use.
So how many do you have left? Do you have a lack? Do you sense a lack?
So as I said, we have about 60 patients in ICU. We have 81 fully ventilated ICU beds, so we still have some capacity. And also we have provided to create like an intermediate care for people who have overcome the acute phase in intensive care, are still not well enough to be discharged to a regular ward, and they will be ventilated via a tracheostomy, a hole that is created in the windpipe, and assist them to breathe while already conscious and able to mobilize.
In the NZZ, it was mentioned that the BAG a few years ago actually issued some guidelines for cantons on minimum reserves on medical material, beds, and that this has not been really implemented by many cantons, actually.
Well, I think no one in Switzerland could say that they have a pandemic strategic plan because we've never been faced in the modern times with a situation like we're facing now with COVID. Perhaps maybe some countries in Asia that had a close encounter with SARS, they might be better equipped. But I think that, trying to plan ahead for something like this to happen and then it doesn't happen for years or for decades, it would be a waste of resources that we can't afford to do. I think the important is to have the ability to respond quickly and to actually create what is the needs that we have to face now. And I think we managed to do that to some extent.
Some politicians in Europe want to prolong the spread of the peak infection over a long period, while the population can build up immunity. So Dutch Prime Minister Mark Rutte, for instance, said that like these hospitals and intensive care units are not overburdened and have capacity to help the people most in need. So it was also the talk about herd immunity. He then said that that was not the main priority, but a side effect. What's your take on this?
I think, the fact that we have introduced measures for social distancing and also closing businesses, etc. These are measures that have been met to try to contain the spread of the virus among the population. So what will happen is that they will flatten the peak, but extend the time where the epidemic goes around in the population. Now, hopefully, this will create some immunity in some people that are not at risk, particularly young people, and then kind of create what is meant with this concept of herd immunity, that if a lot of people are immune and therefore cannot transmit, the likelihood of then infecting susceptible people like elderly or people that are frail and have other medical conditions will decrease.
So looking at herd immunity as an isolated case, maybe per se, would it make sense, compared to a future vaccine? Or is it the same effect?
No, I think that, to have an efficient herd immunity, you need an effective vaccine. Trying to, encourage herd immunity by not containing the spread of the virus, it comes at a cost of too many lives, and it is something that we cannot afford to do. Mm-hmm. So I think that the question is what we will do with the containment measures that have been introduced now by government. And I think that at some stage we will have to lift those restrictions the way that probably would make sense, knowing how this coronavirus causes disease in humans, is that probably a stepwise return to normality and allowing first the young people that usually develop the disease without many complications will be allowed back to work or to their normal activity. And that might cause, herd immunity in that population group, and then slowly increasing the age that you can go back to work and your normal daily activity.
Are these people that now had a coronavirus and basically have immunity right now at the moment, are these wanted people in hospitals?
I don't know if you can say that. Certainly, there is no evidence. I mean, there has been some reports of secondary infections, mm-hmm. And there is no evidence on that. So one has to assume that a patient or a person who has had coronavirus, once they have recovered, they're immune. Obviously, they would be wanted in the hospitals if they have the skills and qualifications to work in a hospital, but otherwise, they're not much use.
So as I said in the beginning, we're at around 10,000 positive tested COVID patients in Switzerland. So we usually hear the bad news and also of people dying. Can you put this a bit into perspective?
Sure. I think there are two pieces of good news, and I can speak about the situation in Ticino because I know it better than the rest of Switzerland. But we do a lot of tests, and a lot of people test positive. But 3 out of 4 of the positive tests are people that are treated at home. So they have mild flu-like symptoms, and they don't require hospital admission. And the second bit of good news is that we are now, at the end of week 3 of the epidemics. Yes, we had some people dying, but we also have people that left the hospital, they've gone back home to their families, and they're doing well.
Swiss specialty chemicals company HEIQ developed a new treatment to make face masks more resistant to coronavirus. The ETH spin-off plans to treat 500 million masks with the antiviral product over the next 4 to 8 weeks. Earlier, Olivier Chang spoke to Chief Executive Carlo Centonze and started by asking about his experience transitioning from a company that traditionally treated everyday textiles to creating a chemical solution with the potential to help in this fight against the pandemic.
It has been a quite disruptive experience. We have the technology to help, and we have taken the entire HEIQ team and put it on this task, a task that is urgently needed to protect our healthcare workers in the hospitals. And it has been a very stressful few weeks and months to gear up the technology that can contribute now and make a difference.
Let me pull up an example then. So if we take any mask that has been treated by these chemicals, what is the chance that it will actually block the virus? And how would that compare to, say, a mask that I can pick up at any pharmacy?
We have conducted extensive good laboratory practice research on manifold viruses, including coronaviruses. we see consistently that we have a 2-log higher reduction on contact. So we have a contact kill technology for the viruses. 2-log means 100 times better. So you can assume it's 100 times more protective for the healthcare workers that are wearing these masks than an untreated mask.
For those who are not chemical specialists, walk us through step by step how it can actually increase the resistance to a virus like coronavirus.
Now, the coronavirus is an enveloped virus, like most of the pathogen viruses that humans can contract. Enveloped means it has a membrane, sort of a membrane, a pericapsis, which is a part of the human cell when they are budding. And this membrane is very sensitive. It contains cholesterol. And we can, with a double approach of a silver technology that HEIQ manufactures from its beginning, as well as a booster made out of a vesicle technology, we can manage to quickly capture the viruses and then in seconds deplete the cholesterol content of their membrane and thereby deactivate them completely so they are not virulent anymore. I think in a scenario where a medical worker is exposed to the viruses and they touch the surface of a face mask or also a medical gown, they get deactivated immediately and are after that no more threat for contamination or retransmission from his textile or the face masks to another patient or another medical worker or himself by touching the mask or the gown itself.
So is it right to say that your starting point will be the face mask, but eventually this solution can also be applied to other things like gloves and medical gowns, curtains even?
Correct. So if you take a hospital setting, textiles are one of the main vectors for viruses, but also bacteria, multi-resistant bacteria. The technology we devised really addresses both. It addresses the coronavirus, for example, and the MRSA, the golden staph. All the textiles that are treated with it become basically capable to destroy both of them in seconds to minutes and make sure that there is no retransmission or contamination from these surfaces, thereby reducing the risk in a hospital and the risk also for the medical staff and the patients itself.
How much interest have you actually seen from companies like mask manufacturers for such a solution thus far?
We have a great many inquiries. I think we got, since we launched a week and a half ago, 600 plus inquiries from customers all across the board of the textile industry. Common to all is everybody wants to help to contribute to fight the coronavirus. So we do the most diligent effort possible to support all of them. Obviously, we are prioritizing the adopters that serve the healthcare facilities first. And as soon as we have scaled up to sufficient capacity, we will broaden our scope also to other applications, like, for example, curtains in hospitals that also have a potential for contamination with pathogens.
How many treated masks or other items are we talking about here that could potentially be on the market over the next couple of weeks?
At the moment, we have requests for approximately treating 500 million masks in the next 4 to 8 weeks. This is something we can handle. If we have more requests that will come in, we will go and ask our competitors to work with us to manufacture sufficient quantities.
As a company in the textiles industry, how has coronavirus really made you think about your business model and your approach following the crisis?
Well, HEIQ is known as one of the key innovators in technology in our industry, and as such, we took the responsibility when the coronavirus came up to focus all our resources on addressing this urgent problem for our industry. We have seen already significant disruption. Today, India and Pakistan announced total shutdown for the next 3 weeks. This will affect their economies terribly. The textile is a large part of their economies, and we already see that the thin economical viability of many companies in the textile industry will get stretched by this breakdown. So after we emerge from this crisis, I think there will be a shift in the paradigm how we're going to go about the business. I do hope that there will be a more fair distribution of the margins along the textile value chain, and that we will work more together as one industry.
Carlo, thank you so much for joining us here today.
Thank you very much.
Paracelsus Recovery treats high net worth individuals on mental health and addiction recovery. Tanya Koenig spoke with Marta Ra, CEO of the Zurich-based clinic, to find out her tips for staying mentally healthy during the coronavirus outbreak.
We have put together 5 tips that can help you and support you during this situation that we are right now, which is number 1, be compassionate to your emotional response and the response of others. Number 2, stick to your routine. Number 3, be informed and listen to the advice of experts and the government, and only check official sources, which means limit your time on social media. Number 4, reach out to your loved ones and seek professional help if needed. And number 5, observe your thinking pattern.
Okay, can you elaborate on some of these? If you say be compassionate to your emotional response and others, what exactly? Can you give an example? What do you mean by that?
So actually, there is no right way to respond. So we are currently in a crisis, and we all have different ways of dealing with difficulties. Someone respond with anxiety, sadness, and that's very normal. But it's key to acknowledge your feelings and not to act on them. And if you are, for example, a CEO of a company, it's okay to have fear and it's okay to be in panic. It's okay because it's vital for you to look after your business and your employees. But also if you are a mother or a father of your child and you are in fear of your health of your child, acknowledge that you are in a particular situation right now and that you're worried, and just accept it. And then the next step is how to deal with it and how to behave with it. And there are different ways how you can cope with situations like that.
Then you mentioned you should reach out to or get some help. What do you mean by that?
Currently, people who seek professional help is very high. Still, even though there are a lot of hotlines out there globally where people can reach when they are in mental distress, the best way is to reach out to people who you are most close to. Who knows? Is it maybe your friends or your sister or your brother that you have not spoken to a long time ago, or maybe some friends from high school? So try to be creative and don't stick to the old way. We have Skype, we have FaceTime. There are many ways to connect, and connection is right now very important. And if you don't have someone you can connect to, then please seek out for professional help. And there are a lot of offerings out there.
And some more headlines for you today. As China braces for a second wave of the coronavirus, its factories are helping manufacture protective gear for other countries. The Chinese government has ordered 4 million protective eyewear and 6 million masks from this factory in Shenzhen to donate to the UK, where there are more than 8,000 confirmed cases. And Dyson may be known for vacuum cleaners and hand dryers, but the company has shifted its focus to ventilators. James Dyson designed a new one in just 10 days. Now he's making 15,000 of them to fight COVID-19. Dyson says the Covent, as it's called, can be manufactured quickly, which is key as the demand rises fast. And Airbnb has stepped up with a plan to offer free or subsidized housing to people working on the coronavirus front lines, namely health professionals, emergency workers, and relief personnel. And Swiss tennis star Roger Federer and his wife Mirka are donating 1 million Swiss francs to Swiss families in need amid the coronavirus pandemic. Here's Matt Layton with more on some people in the sports world who are also stepping up.
In Switzerland, there are starting to be some very interesting initiatives, fundraising to help out the less fortunate of the coronavirus Roger and Mirka Federer announced yesterday a personal donation of 1 million Swiss francs for the Winter Aid Association to help the people really suffering. We've seen on the back of that the Swiss men's football team have actually made a wonderful rendition of Imagine by John Lennon, and they're raising funds and contributing to the Swiss Professional Nurses Association, buying equipment there. In general, it's going particularly well, and it's starting to be coordinated. I just caught up with Mike Kurt, who's the founder and board member of I Care for You, to find out about some other initiatives.
Yeah, we've actually launched yesterday a campaign on I Care for You, which is a foundation that has been founded 5 years ago. And we are raising money for people who really have the financial distress or the urge to get money and that really need help from us now financially.
So who are the backers? Who are the people contributing already? You say 800,000 Swiss in one day.
Right now, they're basically big foundations and private donators.
Who are you hoping to give the money to, and how quickly can you give them the money? And is it a loan?
That's exactly our unique selling proposition. We are already able to distribute the money because we obviously already have 800,000 Swiss francs. And we're going to donate it mainly to private people, the ones that really need it now. It is not a loan. It is, as we say, a fonds perdu, so they don't have to pay it back. They just get the money. They have just to apply for it, and we give them the money.
And as you're a foundation, this is, I guess it's non-for-profit, so you're able to give most of the money, pass most of the money on.
Exactly. It is. We're not getting anything out of it. We're just passing the money on, and it's also a great opportunity for our foundation. I mean, it's now the time to help, and this is our purpose, and that's why we are here.
So these and many other initiatives are helping the Swiss people fight their problems.
You can get involved in today's news, as always, by checking out our social media pages on Twitter, Instagram, Facebook, and LinkedIn. Whatever the comment, it's always great to hear from you. And don't forget, everything is also available on our website, cnnmoney.ch. Do take care, and we'll see you tomorrow.